we now have a presentation, a Bay Area pedestrian and bicycle study update that will not be presented by Susan Jaworski. It will actually be presented by Christopher Whaley with our regional multimodal planning team. Chris, would you like to share your screen and get going?
Yes, I will go ahead.
All right.
Okay, can everyone see that?
Yes.
Okay. So yeah, I'm Chris Whaley. I'm the project manager for the Bay Area Ped Bike Safety Study. And so I wanted to give an update as we prepare to close this study out. So a refresher on the boundary for the study area. So it's bordered by Spencer Highway on the north, Beltway 8 to the west, Clear Creek to the south, and Galveston Bay to the east. And this is showing the logos of all the organizations involved. So this is an HGAC-led project with Harris County Precinct 2 serving as the local sponsor. HGAC has procured a consultant team to assist with the project. They are headed by Half and Associates. The 3 remaining firms are subcontractors that Half used for specific analyses throughout the study period. And this is looking at the timeline of the project. So it was broken down into 4 parts. So a project initiation, a needs assessment, recommendations, and then finally planning for implementation. As you can see right now, we are working on plan recommendations and the implementation plan. Task force and public meeting number 1 during the study were used to identify community needs. For the recommendations, a gap analysis was conducted to gauge blind spots in any of the and any areas of the recommended improvements. For public involvement, the project is overseen by a stakeholder task force. So includes local government and transportation agencies, so including the City of Houston, TxDOT and Metro, as well as others. And also includes active transportation advocates. So for example, in Houston and Space City cyclists, as well as a variety of local residents and community leaders. So this task force met quarterly over the duration of the project. We have one final meeting that will be coming up in the next couple of weeks. And other stakeholders were engaged through focus groups and public meetings. For public involvement, there was an initial survey that was open for a 3-month period to incorporate areas of desired improvements. We also had several events held in coordination with NASA, and then we had the final outreach event take place last month in early June of 2024. So for the existing conditions component, included a plan and policy review, which was a comprehensive overview of all existing plans by all jurisdictions in the study area. There were also analysis of the demographics, land use, and transportation in the study area. Data from the company Replica was used to track the current activity of active transportation users. And finally, an analysis of crash hotspots in the study area was also performed. So this map is showing that crash hotspot analysis. So within the past 5 years, there have been 233 crashes involving cyclists or pedestrians, resulting in 20 total fatalities and 36 serious injuries. So the map shows crash locations and hotspots, of which there are several in the study area. Many of these, including FM 528 and Bay Area Boulevard, as well as Space Center Boulevard and Bay Area Boulevard, are both within half a mile of schools. So as we continue to build out the recommendations, these particularly dangerous intersections and locations will have specifically targeted interventions proposed for them, and the exact methods of interventions are still to be determined. So this slide is, and the following slide use data from the company Replica that uses multiple sources, including mobile phone data, to approximate the number of bicyclists and pedestrians that travel within the area. So this shows bicyclists, and I think you can see obviously adjacent to Gulf Freeway, as well as towards NASA, there's definitely a visible hotspot. And then again, this slide is just showing the data from the same company, but just walking or pedestrian trips instead of bicycle trips. Then this map is showing that we also use Strava data to compare it to the data that I just showed from Replica, and just have a sort of redundancy in the data source. Because this is kind of because Strava tends to overrepresent recreational trips more than those used for transportation. And for this analysis, the study was divided into traffic analysis zones, and trips were totaled for both inside each zone, which is what the intrazonal trips refers to, and then between each zone or the interzonal. And again, this slide it shows is measuring specifically bicycle trips. And then this slide is the same sort of methodology, but note it's only showing pedestrian trips. So for pedestrian trips, they were only intrazonal, which makes sense given the reach of a bicycle versus the reach of a pedestrian. So this shows what is referred to as a level of traffic stress analysis. So this takes several factors into account, including the number of traffic lanes, the vehicle traffic count, as well as posted speed limits to come up with a numerical score from 1 to 4, with 1 being the least stressful for bicyclists and 4 being the most. Yeah, and I think this map pretty clearly shows, there is currently no low or medium stress route for travel from one side of the study area to the other. And then this slide shows a very similar methodology, but but it scores intersections as opposed to roadway segments or corridors. But you can see there was a similar outcome produced in terms of traffic stress for pedestrians. Most, I think, if not all, are level 3 or 4. So the recommendations that the plan proposes are divided into 2 groups. So infrastructure improvements, and then program and policy opportunities. For the infrastructure improvements, the mobility toolbox acts as a summary of the possible countermeasures that can be considered for implementation. So includes a variety of strategies, so including raised sidewalks, pedestrian gates at railroad crossings, asphalt art. And this is just an example of a selection from the mobility toolbox. So these 3 strategies represent innovations compared to the current conditions in the study area. And I also want to highlight that they have a relatively low implementation cost and do not require any major construction to install. So this map shows the proposed bicycle network in the study area. So note that the shared use paths follow roadways, where multi-use trails are off-street. So they follow a bayou or utility easement, but both but they're considered one and the same for the study. We're just showing them differently here to distinguish the facilities again that follow a road or not. And the highlight here, I think, is that the proposed facilities would put 99% of the residences within a half mile of a bicycle facility, where that number today is only 50%. As far as recommendations, they were prioritized using multiple methods, so including safety, connectivity, feasibility, community, and health. So the comprehensive table was created to aid jurisdictions in implementing and sequencing the proposed recommendations. So this is an example of the implementation table that is being developed. So note that I would want to note that the time frame, so it's either short, medium, or long term, as well as the lead and partner agencies and costs are all, these all provide helpful information when considering what recommendations should be implemented. And then so tables for on-street bicycle projects, off-street trail, and trail crossing projects were all also created in approximately the same format. So for next steps, we just it's really finalizing all the materials at this point. So that includes the final study report as well as the recommendations, as well as and cost estimates. And we plan to have the final task force meeting take place during the week of July 29th. And so that's all the information I have. So the project website is on the screen, and then my email is there if anyone has questions.
Great, thank you. Very informative and thorough presentation. Is there any questions from anyone? All right, well, with that, thank you again. Great job. And Stephen, I think we're ready to move on to the next item.